Depression doubles your long-term risk of death after a heart disease diagnosis. That's the conclusion by researchers at Intermountain Medical Center Heart Institute after a 10-year study of nearly 25,000 patients.
It surprised me in that after taking into account a whole bunch of other risk factors, depression was the strongest predictor of death.
Stronger than other traditional risk factors such as high cholesterol, diabetes, and high blood pressure. The study shows people with heart disease diagnosed with depression are twice as likely to die compared to those without depression. Dr. Heidi May is a cardiovascular epidemiologist at the Intermountain Medical Center Heart Institute and the author of the study. She says this research was different because they didn't just check for depression 30 days to a year out from a heart disease diagnosis.
Usually they assess depression in hospital, 30 days and maybe the year at the most, but this study was different where it took into account all their follow-up and the impact depression made throughout their follow-up. So in that way it's unique in that it took into account that long follow-up and assessed depression years down the road.
Researchers say the stronger connection between depression and heart disease can be biological and behavioral.
They don't tend to follow the best diet or exercise, or not as compliant with their medication. So there's kind of that give and take of it can be biological and behavioral. The big takeaway is that depression is a risk factor continually. When people have their heart disease diagnosis, they need to be screened. It's just not those 30 days or 3 months or that year after that diagnosis, but it's something that needs to be screened throughout their life.
Dr. May and her team will present the findings of this study tomorrow morning in Washington, D.C. at the American College of Cardiology's annual scientific session.